as registered nurses at Memorial, we work very hard to ensure that patients get the highest quality of care. We have a large team of other workers that help us give that quality care, and we're excited to see that you're considering joining us with 1199 to make improvements to your own working conditions and benefits.
The nice thing about working with the RNs in our bargaining unit is the fact that we support each other. Whatever they're going for, we support them. Whatever we're going for, they support us.
I realized I was earning 30% more at this new job, and that equated to about $800 more a month in my paycheck. And I wasn't working crazy overtime, and I didn't have all these terrible rules that I had to follow.
I can tell you that myself, I've had about a 25% increase in pay over the last 2 years because my career field was being paid well below the industry standard. And because of the union, I'm now getting paid at a competitive range.
And when you're hired in at step A because we have set that step at a competitive step with the community. And then every year you get a 3% increase that you stay at Harborview. And that takes away that problem of new hires getting paid more than a senior tech.
We are in the process of buying a new CAT scanner, and I am part of that process. It's really great to be part of that process because I'm the one who knows the scanner. The techs are the ones that know the scanner, and we know what's best for the patient. We know what's best to get the best. We know what's best for to get the best possible exam. And without a union, I would not be part of that process.
I'm a patient advocate. I'm trying to always do what's best for the patient, but in situations like we had last fall where 6 of our employees in the RT department out of 15 were out for over 3 months. We worked short staff. We just were overwhelmed. So, we began to fill out, look in the union contract to see, well, what can we do? And through that whole process, we're able to, by January, hire 6 more RTs. And that's how the union helped us to do that, to have a voice.
One of the great things in our workplace right now is when the boss wants to make a change, he comes and gets myself and a couple of our other leaders in radiology, and he sits down and he talks those changes over with us.
And one of the wonderful things that we've accomplished through bargaining is we've got very strong language around call. We protect people's personal time. No employee will be forced to take more than 50 hours of call per month unless they elect to. And when you do take call, you're protected. You can only be called in for urgent or emergent reasons. And we have a collaborative meeting where we agreed with management, and even physicians were on that committee, what is urgent and emergent. So we're not abusing people. People are called in when it's a real patient emergency.
We have worked as a technologist. We've been working on things with call and callback and understaffing and how we deal with that. The RNs have had things that were established before the technologists had brought up certain issues, and we were able to kind of follow in their footsteps and get the same things that they were offered also. And it's been so important. I mean, we've been able to provide much better patient care because of that.
We joined the union and 2 things happened. We got rid of that PTO where we could have sick time separate from vacation time, which protected particularly people with children, young children, who needed to use that sick time separate from their vacation time. And we got a low census fund. So when it was slow, that we could come to work and do some other sort of chores and get paid the wage that we were promised to when we signed on. That's what the union did for us.
The single biggest difference between being union and non-union is with union, we now have security. We know what we can expect. We have a contract that we can turn to and say, hey, wait a minute, you're doing this wrong. We need to sit down and talk about this. And they have to negotiate with us.
And I started to change my mind. I started to really see the difference in the quality of my job and the conditions that I worked under, and it was because of the union.
I'm Scott Kennedy. I'm an angio tech at Harborview Medical Center. I'm a proud member of SEIU Healthcare at 1199 Northwest.
I work at Valley Hospital in Spokane, Washington. I'm a pharmacy tech, and I'm a proud member of SEIU Union.
I'm a lead CAT scan technologist, and I'm a proud member of SEIU 1199 Northwest.
Hi, my name is Jim Gonzalez, and I'm a nuclear medicine technologist at Kennewick General Hospital, and I've been there for 8 years.
Hi, my name is Rick Hardwick. I'm a respiratory therapist at Valley Hospital in Spokane.
I'm Kelly Bleweiss. I am a registered radiologic technologist at Swedish First Hill, and I'm a proud member of SEIU 1199 Northwest.